This video is the proprietary content of Pusat Perubatan Universiti Malaya and is intended for educational purposes only. Please ensure proper acknowledgement when using or referencing this material.
Welcome to our training video on administering medication through a peripheral intravenous catheter. This video will guide you through the essential steps to ensure safe and effective medication administration. Patient safety and accuracy are our top priorities. First, begin by preparing the patient. Confirm their identity by scanning the barcode on the patient's wristband, and clearly explain the procedure to them or their caregiver. Perform hand hygiene before touching the patient. Ask about any past issues with intravenous administration, or any known allergies to medications. Finally, be sure to obtain verbal consent before proceeding. Healthcare worker must have short, clean nail with no nail polish. Shirt sleeves are short or rolled up. Ties, lanyards, scarves are tucked in. Perform hand hygiene before touching the patient. Inspection of vascular access device. Assess patient's catheter site for sign or symptoms of infection, infiltration, and extravasation. Perform hand hygiene before preparation of IV medication. Next, gather all equipments. Start by cleaning the blue tray or trolley with hospital-approved disinfectant wipes. Then, gather the equipment such as the prescribed medication, 3 syringes, 1 for medication, and 2 for the sterile normal saline 0.9% flush. You will also need 70% alcohol swabs, sterile cap or stopper, 2 vials of 10 milliliters normal saline 0.9% for flushing to ensure smooth and safe procedure. Perform hand hygiene before preparation of IV medication. IV medications prepared using aseptic non-touch technique, ANTT. And review any medication syringe for the name of the medications, dosage, and the time of preparation. Verify the medication order, ensuring you have the correct medication, dose, route, and timing. Perform hand hygiene before aseptic task. Scrub the hub for 15 seconds or 30 twists, using 70% alcohol. Allow the hub to dry before use. Open the sterile cap while maintaining aseptic non-touch technique. PIVC should be assessed for patency by flushing using normal saline 0.9%. and aspirating for a blood return prior to each infusion. This helps ensure proper catheter function and helps prevent complications. Administer IV medication using aseptic non-touch technique. Administer IV flushing using 0.9% normal saline with the push-pause technique. Following aseptic non-touch technique. This involves delivering 10 short boluses of 1 milliliter solution, with brief pauses between each to ensure effective flushing. Scrub the hub for 15 seconds or 30 twists after flushing. Perform hand hygiene after potential exposure to body fluids. Clean tray with disinfectant wipes. Document and e-prescribing in EMR. Thank you for watching. We hope this video has been helpful in enhancing your clinical practice. Please note that the content is based on the guidelines on peripheral intravenous catheters, PIVCs, for adults in UMMC. Stay committed to providing the best care for your patients.